We're going to talk tonight about spirituality and health. So the first thing I'm going to ask both of these two is, can you be spiritual without being physically healthy? And if you are not physically healthy, can you be spiritual? You've done this with me loads of times, so you've got to go next.
I go next.
Yeah.
Well, I think the short answer is to the second question is yes. That's the simple answer. The spiritual view of illness, and indeed the relation between illness and suffering and life, is that essentially a glitch at the subtlest level of life, soul level, will, if you like, titrate through the different levels of the being. So we move through from the spiritual level through to the energetic level, the mental level, emotional level, and physical level, ultimately. But that's not to say that a person can't be very spiritual while having some sort of handicap of any kind. I mean, there's many instances of great spiritual teachers who suffered some illness, or indeed took on some illness of their family and or community as a kind of a service, which of course is a highly sort of spiritual act.
What do you think, Liz?
I think I'd agree with that. I feel that it's not an either or, black or white thing really, and I think that my experience is that human suffering is part of the human condition. We may not like that, and my experience about being a GP, which is what I've been most of my working life, is that some people embrace that and some people fight it, and I think those that embrace it do much better than those that fight it, really. And for me, the mind, body and spirit are all linked, and they're not separate, and to sort of think we can get one compartment right is just a wrong way to look at things.
So what happens when you have a really sudden change in the level of awareness? Because you've had, I mean, I'm not saying you personally, but you've had hundreds of people in your practice, because you've been very modest about your qualifications.
Flattery will get you nowhere.
No, but it's true.
Yeah. So what are you getting at, Polly, with that question?
Well, for instance, when we've been and worked in mental health facilities, and you see some people who are fairly rational and obviously have had a massive change in their personality status and have to learn to manage it. And then you have some people who are definitely mentally unwell. Where were you in the relation to that? How did you manage dealing with those different states?
Well, I think I think I'm traditional medicine, which is what I've worked in for some of my life, and then I think that just being the person that's there and not actually doing much traditional medicine, but actually being the person that someone has come to see, that they've chosen, that was actually more effective, I think, than many of the potions or whatever you want to sort of call them that I've dished out. I'm not saying that they're not helpful, and they are really. But I think everything's processed physically, and I think medicine can help that, can facilitate that processing. So I don't think it's one thing that you can just sort of say, well, it's being processed, something's happening, there's an energetic sort of change, and therefore we shouldn't do anything else to sort of to facilitate that. And I think people have to find their own way through that, and what actually sort of helps them in whatever sort of medium or whatever approach that they sort of want to. But I don't think there's one thing that's the be all and end all. And then there's the other extreme of people having very extreme medical, physical ill health. I can't explain why that happens to people. No one can. Part of that might be processing of things sort of happening. But I think it equally is about how people respond to, inverted commas, ill health, and how they perceive it or frame it. I'll talk a little bit more later on if you want
As
to.
a result of treating those sort of cases, did you find that you changed your own beliefs and spirituality?
I think I realised that physical medicine is very limited as to what it can do. It can be very helpful for some things, if we're being honest, I've been in medicine over 30 years, and I've seen the wheel go around so many times. And if you sort of think for something like HRT, it's been good, it's been bad, it's been good, and it's been bad in my working lifetime. And I think that says something about the science behind it. So I think we have to accept that even in this very technical, amazing world, really, of invention science, the understanding is limited, really. And I think what I learnt over time was that actually just being present with someone and listening was probably the most important thing that I can offer someone. And I feel that was a real gift, I think, and it was a two-way experience. So I think if you're present, it is a two-way, irrespective of what happened as an outcome of that, I think that for me was the most important bit about being a traditional doctor.
What do you think about all that?
Well, I think it's that's Les just made a very interesting statement in that, that final conclusion is that the nature of the communication between you as the doctor healer and taking the time to hear and listen to what the person is saying to you, that is the kind of, perhaps, the really sort of significant healing event or transmission. And I mean, that's very much an attitude of a complementary or holistic healer. I would imagine probably 80% plus of people who come to see me about whatever it is, and I'll always ask them, have you seen your conventional doctor? And when they have, if they have, there'll usually be a kind of comment, well, I did, but of course they don't really have time to listen, do they? That seems to be a very, very common theme, that essentially the structure of conventional medicine actually isn't really patient-centered. It's more about the business of the NHS and how it's set up. And I think that many patients often feel that they don't get perhaps what they could for that reason, not enough time, and perhaps the doctor is more focused on prescribing rather than listening. But energetically, in my book of life, my book of healing life, it's about three things: person wearing the healer's hat, person wearing the patient's hat, and the energy between, that kind of communication, that transmission. That's key. And if we all kind of work with that, then it takes us into a triad of that you started talking about, body, mind, spirit. And when we kind of, if you like, allow the presence of spirit to be in our clinic or in our healing space, then that's when sort of extraordinary things can happen, and that's when whole energy opens into a different kind of a different kind of a dialogue.
So is it visible or invisible? Is it an energetic thing just as much as, flapping your mouth?
Oh, absolutely. Absolutely. And I think the more that the practitioner holds that consciousness, or we talk about holding a neutral space that brings that allows and invites the person into it as being an integral part of it, and that it's a dialogue rather than, me, giving herbs or giving needles or advice. It becomes communication.
Yeah, but most of your people become silent communication because they go completely.
How do they go?
They zone out.
Well, it depends on the kind of the nature of the treatment, but this is very much about expectation. What do people expect when they come to see a healer?
Yeah, can I just come back to you about just one thing? Because I feel this issue about time with doctors is a false issue, really, because I think a lot can be achieved in 10 minutes. And I've always believed that if you allow someone to tell their story, they'll tell you what they really want fairly quickly. The problem is they get interrupted a lot of the time with sort of doctor-focused or doctor-agendaed sort of questions, but actually most people have rehearsed, I think, what they would like to say in the waiting room. They just don't get a chance or an opportunity for whatever. And I think there's something about ownership as well, about whose problem or whose issue. So I wouldn't see myself as traditionally a healer. I think it's just someone coming along and telling me something and sharing an issue or a problem. And then let's see where we go with it. And if there's a positive outcome from it or a way forward, then that's fine. And if there isn't, then maybe they need to look elsewhere or someone else or a different route, really. But I do feel that an awful lot can be achieved in 10 minutes. It is actually a very long period of time. I don't know if any of you have had a positive experience with a traditional doctor within the 10 minutes, but you can get a lot sorted within that time.
You could get a lot sorted because you carried an otherness.
Yes.
I used to watch staff and patients suddenly go from being totally irrational and unreasonable to being, for you to be able to communicate with them. That was nothing you doctored.
No, but I think I've been put my hand in my heart. I wasn't like that with everyone. But I think if you could try and be present, and I think part of the problem is that there is lots of constraints on the health service, and there's nothing worse when you go in and be sort of told that we've got 20 extras this morning, and it's really hard to clear your head and be with the person in front of you, knowing there's an extra 20 people. But I think if for me, it was about if I could be present with sort of someone, which means putting the computer on the side, because I think that's been very, very helpful on one level, but it's been an absolute disaster from the point of view of communication. And when I first started medicine, we had the old patient notes, which were wheeled in large volumes for some people, but actually you didn't have that distraction. And sometimes I think, I don't know what your experience has been, but it may have felt that the doctor's been attending to the computer and not to the person. And I think very strongly that we should always be with the person, and the computer can be attended to afterwards. That's my opinion.
So does that mean you give them 7 minutes and 3 minutes to write it up?
No, I give them a bit longer than that, and sort of back at the computer and just put something on, and I get my hand slapped later on. But we all have to manage sort of time frames and things, but it's how we are now.